name is Stephanie Corbett. This is my motor assessment for health appraisal and assessment. Hi, I'm Stephanie.
I'm Dave.
Nice to meet you, Dave. I'm your nurse today, and we're going to do a comprehensive head-to-toe assessment. Are you ready to begin?
Yes.
Okay, perfect. Can you start by telling me where you are?
The exam room.
The exam room. Very good. And can you count forward from me from 8 until I tell you to stop?
Yes. 8, 15, 24, 32,
Good.
40.
Good. Okay. So your cognition is intact. Okay. So we're going to start with visual inspection, okay, of your skin. The client's skin is appropriate color for his ethnicity. There are no lesions, there are no rashes, no blisters of any kind. The client's temperature is warm to the touch. His skin is dry. It is also clean. Let me see your arm. The client's skin turgor on his legs and his feet is normal. There is no tenting. All right, we're going to move on to your hair now, okay?
All right.
The client's hair is uniform in color, dark. It is uniform in distribution. There are no bald spots. The hair is soft and fine on his extremities and soft and fine on his head. All right, may I see your nails? The client's nails are clean, trimmed short, uniform in color, pink. The cap refill on the upper extremities is less than 3 seconds, and the cap refill on the toes is also less than 3 seconds. Visual inspection of the client's head and face revealed that the client has symmetrical facial features. All right, I'm just going to palpate your head, okay?
All right.
Any pain or tenderness?
No.
No? Good. Okay. Any pain or tenderness here?
No.
Any pain or tenderness here?
No.
Okay. Palpation of the client's head, the frontal sinus, and the maxillary sinuses reveal no pain or tenderness. Can you please, like this, open and close your jaw a few times? One more time. Very good. Palpation of the temporomandibular joint reveals that the jaw opens and closes smoothly. There is no clicks and no rubs. Okay. Now I'm just going to assess your trigeminal cranial nerve, okay?
All right.
So I'm going to put my hands right here on this masseter muscle. Can you clench and unclench your teeth for me?
Mm-hmm.
Very good. Okay. Now, the last thing I'm going to do for that nerve, I just want you to close your eyes. I'm going to take this cotton ball, okay? And then I'm going to touch your face. And when you feel me touch your face, just say that you feel it.
Got it. Got it. Got it.
Okay, very good. The trigeminal nerve is intact. You can open your eyes now. Okay, now we're going to assess your facial nerve. So I'm going to ask you to do a couple of things with your face, okay? Can you raise your eyebrows for me? Very good. And can you close your eyes really tight? Good. Can you smile? And frown? And purse your lips, like this, like you're going to whistle? And show me your teeth? Very good. Okay, so your facial nerve is intact. We're going to move down to your neck now, okay? Visual inspection of the neck reveals no lesions. The trachea is midline. I'm just going to palpate now, okay?
All right.
I'm palpating your trachea. It's midline. And I'm going to palpate for tracheal tug. And there is no tracheal tug. Okay, very good. We're going to examine your thyroid now, okay?
Okay.
So I'm going to give you a little glass of water. Now you're going to put the water in your mouth, but do not swallow it, okay? And then you're going to tilt your head to your right, and I'm going to put my hand right here while I feel and push this way, okay? And then you'll swallow when I tell you to swallow.
All right.
All right, go ahead and take a sip of water. And tilt your head. And swallow. Very good. Take another drink, go ahead and do the other side. And tilt your head this way. And swallow. Very good. So palpation of the thyroid gland reveals no abnormalities. I'm going to look at your lymph nodes now, okay?
All right.
Okay, so we're going to start in the back. The occipital, the postauricular, the preauricular, the tonsillar, submandibular, submental, postcervical, superior cervical, and supraclavicular. Any pain or tenderness?
No.
Palpation of the lymph nodes reveals no pain and tenderness and no swelling. Okay?
Okay.
Alright, now we're going to do your eyes. So, inspection of the client's eyes reveals that the eyebrows are uniform, the eyelashes are full and dark, there are no missing or bald spots. The client's pupils are dark, equal, and round. The irises are round and both dark brown. The sclera is white, and I'm just going to look at your conjunctiva down here. Look up. Good. And look down. Good. And the conjunctiva are both normal. Okay, I'm just going to touch right in here. Any pain or tenderness in this area?
No.
No? Okay, so palpation around your eyes reveals no pain or tenderness. Okay, we're going to do your ears now. Okay?
Okay.
Inspection of the ears reveals that they are both midline. Any pain or tenderness?
No.
No? Okay, no pain or tenderness on the ears. Okay, we're going to test your optic nerve, okay?
Okay.
So this is a Rosenbaum card. You're going to cover one eye and hold it about arm's length away and read the smallest line that you can. Okay? Cover one eye.
All right.
Right about here. Okay, now read the smallest line that you can read.
63782 WMNSDO41.
Okay, let me see.
That's all the way at the bottom.
Very good. Okay, now cover your other eye and do the same thing. Smallest line you can read.
63782 WMNSDO41.
Good. Okay. We're going to do the confrontation test now, okay?
All right.
So what's going to happen is you're going to cover one of your eyes, and I'm going to put my hand above and below and then from the sides, and it's just testing your peripheral vision. So whenever you begin to see my fingers doing this, let me know, okay? So which eye would you like to do first?
Do the right eye.
Okay. Now I'm going to cover my eye too. Okay? Look at me.
Yeah.
Okay?
Yeah.
Okay?
Yeah.
Okay?
Yeah.
Okay, and we'll do the other eye. Look at me.
Yeah. 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 Yeah.
Okay, very good. So that's your optic nerve. Okay, now we're going to test your ocular motor, your abducens, and your cochlear nerve. Okay? So we're going to start testing your corneal reflex. So I'm just going to shine this light on the bridge of your nose so you can just look right at me. Okay?
All right.
Good, the light reflects equally in both eyes. Okay, now we're going to do the cover-uncover test. Okay, so I want you to cover one eye and focus on my pen light, and when I tell you to uncover it and look at it, okay?
All right.
With both eyes. So cover one eye. Good. Focus on my pen light. Now uncover your eye. Very good. Now let's do the other eye. And look at my pen light. And uncover your eye. Very good. Okay. Now we're going to do the 6 fields of cardinal gaze. Okay, so without moving your head, follow my pen light. Okay?
All right.
Very good. So your cardinal gaze is intact. We're going to do your lid lag now. So again, without moving your head, follow my pen light. Very good. Okay. I'm going to test for direct and consensual pupil constriction, okay?
All right.
So I'm just going to shine your light in this eye, and I'm going to look at your left eye, and the pupil constricts. Very good. And I'm going to do it one more time, and look in your right eye. And that one we're gonna do the other side. Ready?
Alright.
Very good. Your right eye constricts. And your left eye constricts. Very good. And the last thing we're gonna test is for accommodation, okay?
Alright.
So pick something behind me,
Alright.
okay, and look at it. And when I tell you to, change focus and look at my pen light.
Alright.
Now. Very good. So the pupils constrict to see something close and dilate to see something farther away. Okay, those are your eyes. Alright, we're going to test your hearing now, okay?
Alright.
So this is going to be your sensorineural hearing. So what I'm going to do is I'm going to activate this tuning fork. I'm going to place it on the top of your head. And you need to tell me if you hear it the same in both ears or different.
Alright.
Okay?
Okay. Same over here.
Good. Okay, we're going to do the whisper test now. So cover your ear. And I'm going to whisper some numbers in this ear and I want you to repeat them, okay?
Okay. 4, 8, 9.
Very good. I'm going to cover this one. And we're going to test this ear. You ready?
Ready. 2, 7, 6.
Good. Okay. We're going to do one more hearing test, okay? This is going to do bone conduction versus air conduction. I'm going to activate this tuning fork. I'm going to place it on the mastoid bone behind your ear. When you don't hear it anymore, tell me, and then I'll move it next to your ear. And when you don't hear it anymore, tell me.
Alright.
Okay?
Okay.
All right, here we go.
Don't hear it? Alright, now I don't hear it.
All right, good. We're going to do the other ear, okay?
Okay. Don't hear it? No, I don't hear it.
Okay, good. So air conduction is twice as long as bone conduction. Okay, so we've done your eyes and your ears. We're going to do your nose. So visual inspection of your nose shows no abnormalities, no lesions, no bumps, no deviations. Okay, I'm just going to shine this inside your nose. Okay? Inside of the nose has got no deviations, no abnormalities. Alright, I'm just going to palpate around your nose. Any pain or tenderness?
No?
No? Okay, good. No pain or tenderness. Alright, so visual inspection of your mouth. The lips are pink. They're dry. They are not cracked or broken. Would you mind opening your mouth for me, please?
Ah.
Your teeth are intact. No chips. No missing teeth. Your buccal mucosa are pink and moist. Can you lift your tongue for me, please? Very good. The floor of your mouth is pink and moist. The roof of your mouth is pink and moist. The tongue, top of your tongue is pink and moist. We're just going to check the sides of your tongue really quick, okay?
Alright.
So I'm just going to put these gloves on for a moment. I'm going to use a little bit of gauze. Alright. Stick your tongue out.
Ah.
Very, very good. No lesions, no sores. No lesions and no sores. Very good. Let's go in the trash. And get a tongue depressor. Okay. you open your mouth for me?
Ah.
You see the back of your throat. The throat is pink, the tonsils are grade 4. Tongue down, can you stick your tongue out and say ah? Very good. The uvula raises when you say ah. The glossopharyngeal and vagus nerves are intact. Can you stick your tongue out for me and wave it side to side like this? Good. Your glossopharyngeal nerve is intact as well. Okay, now we're going to test your spinal accessory nerve. Okay?
Okay.
Can you turn your head from side to side? Rotate to the left and to the right?
Yes.
Very good. And against resistance? Good. And this way? Good. And can you shrug your shoulders? Good. And against resistance? Good. Your spinal accessory nerve is intact. Okay. We're going to move on to your chest. So I need you to please remove your shirt.
All right.
Okay, very good. I'm going to start with your posterior chest, okay?
Okay.
All right. Inspection of the posterior chest reveals that the chest is normal in shape. The anterior-posterior diameter is less than the transverse diameter. There are no lesions. There are no rashes. Okay, I am just going to touch your back for a moment, okay?
Okay.
All right. Palpation of the posterior chest in a Greek key pattern. Any pain or tenderness?
No.
Good. And the lateral? Any pain or tenderness?
No.
No. Okay, so palpation of the posterior chest reveals no pain and no tenderness. All right, I'm going to percuss your chest right now, okay?
All right.
So using my middle finger and no other ones. Ready?
Ready.
Percussion in a Greek key pattern. No abnormalities. Okay, I'm going to palpate for tactile feminist now. So I'm going to place the palms of my hand on your back, and I want you to repeat the word 99 every time I move my hands, okay?
All right.
Go ahead.
99. 99. 99. 99.
Okay, so palpation for tactile feminist on the posterior and lateral chest is negative. All right, and I'm just going to palpate for thoracic expansion. Take a deep breath and let it out. Very good. Thoracic expansion is regular. Okay, I'm going to listen or auscultate to your back, the posterior chest, okay?
All right.
So I just need you to breathe normally through your mouth.
All right.
Okay? Auscultation in a Greek key pattern. Go ahead and breathe. Okay, auscultation of the posterior chest reveals clear breath sounds in all fields and no abnormalities. Okay, now we're going to do the anterior chest, okay?
All right.
So, visual inspection of the anterior chest reveals no lesions, no rashes. The chest is normal shape. The anterior-posterior diameter is less than the transverse diameter. The client is breathing without difficulty at a normal rhythm and rate of 16. There are no retractions and no use of any accessory muscles. Breathing for the posterior chest was normal. The client was breathing without difficulty at a normal rhythm and rate of 16 with no retractions, and no use of accessory muscles. Okay. I'm going to listen to your front, okay?
All right.
So just breathe normally through your mouth. And we're going to do this in a Greek key pattern.
All right.
Okay, go ahead. Very good. Auscultation of the anterior chest reveals clear breath sounds and no abnormalities. Okay, I'm going to have you lay down, please, right here. So your right side is towards me.
All right.
Okay, and we're going to assess your heart and your vessels. Can you move just a little bit closer this way? Okay, so the 5 assessment areas for the heart are the aortic area, which is the second intercostal space, right sternal border. The pulmonic area is the second intercostal space, left sternal border. Erb's point, which is the third intercostal space, left sternal border. The tricuspid is the fourth intercostal space, left sternal border. And the mitral is the fifth intercostal space, left midclavicular line. In regards to the heart sounds S1 and S2, S1 is the closing of the mitral and the tricuspid valves. S2 is the closing of the aortic and the pulmonic valves. A systolic murmur is heard after S1. A diastolic murmur is heard after S2. Okay. Visual inspection of the precordial area shows no visible heaves or lifts. Palpation of the precordial area reveals no thrills, no heaves, no lifts, no abnormalities. I'm going to listen now, okay?
All right.
I will auscultate with the bell first, the diaphragm first, and then the bell, all 5 areas. Auscultation of all 5 areas in the precordial area reveals no abnormalities. Okay, I'm going to assess your temporal arteries at this time, okay?
All right.
So I'm going to palpate them first, okay?
All
And
right.
then I'm going to auscultate them. Okay, temporal arteries good. 2+. Carotid arteries, one at a time. Left first. Pulse is full. And the right. Very good. And I will auscultate the pulses with the diaphragm and the bell. palpation of your temporal and carotid arteries reveals no abnormalities. I'm going to palpate your radial pulses now. Very good. And your brachial pulses. Very good. And your popliteal pulses. Very good. Your dorsalis pedis. And your posterior tibialis. Good. All pulses are normal. We're going to move on to your abdomen now, okay?
Okay.
All right, let's take your hands down to your sides. There you go. Okay, visual inspection of the abdomen reveals no lesions. The abdomen is flat. There is a slight aortic pulsation visible just above the umbilicus. No waves of peristalsis noted. All right, I'm going to listen to your abdomen now, okay?
Okay.
Okay, auscultation of the abdomen reveals normal bowel sounds present in all quadrants. I'm going to percuss for dullness now. Percussion of the abdomen yields no abnormalities. I'm going to palpate the abdomen now. I'm just going to press lightly on your abdomen, okay?
All right.
Tell me if you feel any pain or tenderness, okay?
All right.
Light palpation of the abdomen reveals no pain or tenderness. We're going to do deep palpation. It's a little bit stronger, okay?
All right.
All right. Tell me if you feel any pain or tenderness. Okay, deep palpation of the abdomen reveals no pain or tenderness. We're going to palpate your kidneys now.
All right.
Okay, so I'm going to place one hand under here and one hand on top, and you're going to take a deep breath and then let it out.
All
Okay?
right.
Ready?
Ready.
In. Out. All right. And we're going to do the other side. Same thing. In. Out. Okay. Neither kidney is palpable. We're going to palpate your liver now using the hook method. Okay, so I'm going to place my fingers under your right intercostal border. Where is it? There we go, I found it. Okay. Take a deep breath in and out. Okay. Palpation of the liver is normal, no enlargement noted. Okay, so we did your chest, your abdomen. Okay, you can sit up now. We're going to move on to the musculoskeletal stuff. Actually, you know what? I'm sorry. I forgot to assess the range of motion on your hips. Would you mind laying back down for a moment?
No, I would not mind.
Okay, so we're going to do range of motion on your hip first, okay?
All right.
So we're going to do adduction and abduction of each leg. So if you could please swing your leg out towards me. Very good. And back over and across your other leg. Good. And down. And with your other leg straight out to the side. Good. And back this way. Cross over. Good. And down. Okay. Now we're going to do flexion of your hip. Bring your knee up to your chest. And down. And your other knee. Very good. Okay. We're going to do internal and external rotation. So bring your heel to your knee. And out. Very good. Now bring your leg like this. And put it over that way. Good. And the same thing with your other leg. Your heel to your knee. good. Okay, down. Can you lift your hips up off the table? Very good, down. And now we're going to test your hip strength. So can you raise your leg? Okay, good. And your other leg? Okay, good. Okay, now you can sit up. Very good, thank you. Okay, we're going to do your neck now.
All right.
Flex your neck, chin to your chest. Very good. And extend your neck back. Very good. Can you can come straight now.
All right.
Can you do lateral bending side to side? Very good. Very good. And rotation left to right. Very good. Now we're going to do neck strength. Push against my hand. Good. And push against my hand. Good. All right, we're going to do your shoulders now. Shoulders out to the side. Abduction and adduction. Up over your head. Very good. And down and across your body. Very good. Okay. And we're going to do external and internal rotation. So take your hands and put them behind your back like this. Very good. And then up behind your head like this. Very good. And we're going to do strength. So put your arms out. And I'm going to push down on your arms, okay?
All right.
Good. And up. Good. Okay. We're going to do your elbows now. You can put your arms down. All right. Can you extend your elbows for me?
Like this?
Uh-huh. And flex them towards you. Very good. And I'm going to test your strength now. I'm going to pull on them, okay?
All right.
Okay. Very good. We're going to do your wrists now. So flex your wrists up and extend. Good. And your fingers, flex and extend. Very good. And grip my fingers for strength. Very good. All right, we're going to move down to your knees, okay?
All right.
Can you extend your knee out and flex it back? Good. And your other one? Extension and flexion. Good. All right, I'm going to test the strength. I'm going to pull and push on them, okay?
All right.
Very good. Very good. All right, we're going to do your ankles now. So I want you to do plantar flexion. Point your toes to the ceiling. Very good. And then extension. Point them down. Very good. And your other foot. Toes flex up to the ceiling. Good. And point down. Very good. And we're going to test strength. So put your toes up. Point your toes up. Very good. And down. Very good. And now we're going to do inversion and extroversion of your feet. So I would like you to turn your soles of your feet in towards each other. Good. And then out away from each other. Very good. Okay. We're going to jump ahead to the neuro exam.
All
Okay?
right. All right.
All right. So the first thing we're going to do is superficial touch. So I have a cotton ball here, and I'm going to ask you to close your eyes, and I'm going to touch the cotton ball to you. And when you feel it, just let me know, okay?
All right.
All right, close your eyes.
Got it. 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 Got it.
Okay, good. And now we're going to do sensation, pain. So give me your hand. This is the dull end of the paper clip, and this is the sharp end of the paper clip.
All right.
Okay? So I'm going to touch you with either the dull or the sharp end, and I just need you to tell me which end it is, okay?
All right.
Close your eyes.
Dull. Sharp. Dull. 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 Sharp. Dull. 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 Sharp.
Okay. Very good. So that was sensation. Next, we're going to do stereognosis. I'm going to give you two objects in each hand, and you can feel them and tell me what they are.
All right.
Okay? Close your eyes and put your hands up, please. Very good.
That's a coin.
Very good.
That's a key.
Very good. Okay, keep your eyes closed. We're going to do graphesthesia now. So I'm going to draw a number in your hand, and I want you to tell me what the number is, okay?
All right. 2.
Very good.
4.
Very good. You can open your eyes now. Okay. For the last part of the exam, we're going to do reflexes. So I'm going to ask you to give me your arm. Okay. You can put your arm, relax it in my arm.
All right.
All right, I'm going to place my thumb on your tendon, and I'm going to strike my thumb, okay, to elicit a response, okay?
All right.
All right, so that was muscle contraction and flexion of your arm. And we're going to turn your arm over. There you go. And we're going to do the elbow. All right, extension of the arm. And now we're going to do your brachioradialis. You can relax your hand. All right, right behind the wrist. Flexion of the hand. Okay, and now we'll do your other arm. Put your arm in my arm. There we go. Okay, muscle contraction, flexion of the arm. There we go. There we go. Good. Extension of the arm. And your brachioradialis. Good. Flexion of the hand. Okay. We're going to do your patellar reflexes now. Going to strike just below your knee. Good. Good. Extension of both legs. We're going to do your Achilles now. Very good. Contraction. Very good. Contraction. All right. We're going to test your Babinski reflex now. I'm going to come up the lateral side of your foot and make an upside down J. Very good. And with the other foot. Good. Curling of the toes. Okay. We're going to do your range of motion for your vertebral column. So if you could stand up for just one moment. Very good. Flexion of your spine, bend forward. Good. And straight. And extension. Good. And then we're going to do rotation. Good. And lateral bending, side to side. Very good. And we're going to test your balance. Close your eyes. Like the Romberg test. No swing. Very good. Okay, you can open your eyes. We're going to look at your gait now. If you could just walk a few steps this way and back normally. Good. And the same thing but on your toes. Good. And now on your heels. Okay. And now there were a few things that I missed that we're going to take care of very quickly.
All right.
You can have a seat and close your eyes. I just want to test your balance while you're sitting with a sternal nudge. Very good. Open your eyes. And I need to test supination and pronation of your wrists. So if you could just put your hands out and do this. Good. That works. Now, I would like you to take your finger with your eyes closed and touch your nose. And out. Take your finger out and touch your nose again. And out. And again. And a little faster. And faster. Okay, good. And with your other hand. And out. And fast. And faster. And faster. Good. Okay, you can open your eyes. And now I want you to take your finger and touch my finger. And your other finger. Good. Okay, and now just take your hands really quick and pat them back and forth on your lap. Okay, very good. I also forgot to mention during the chest portion of the exam, if I had heard anything abnormal, I would test for bronchophony, egophony, or pectoriliquy. And I'm just going to take a quick moment to overlook my notes and make sure we didn't miss anything, okay? Okay, I believe there was only two things that we forgot. Two parts of the neuro exam. One of them has to do with sensation. So I'm going to activate this tuning fork and I'm going to place it on your joints and I want you to tell me if you feel it, okay?
Alright.
Close your eyes.
Got it. 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 Got it.
Good. And the last thing that we're going to do is for discrimination with joint position. May I see your hand? I'm going to move your fingers either up, down, or neutral, and I would like you to tell me which position they're in, okay?
Okay. Up. Up. Neutral. Down.
And your other hand?
Neutral. Down. Down. Up.
Okay, very good. You can open your eyes now. Thank you. I think we've completed everything. That completes our motor exam. Thank you very much.